On the website, problems that have prevented an untold number of Americans from registering for health insurance should be fixed by the end of November. That's the word from the White House. Friday, the administration hired a tech contractor to oversee the work of 47 other contractors who already worked on Healthcare.gov. Jay Engoff is a former Health and Human Services official who helped set up the healthcare exchanges. Norm Ornstein is resident scholar at the American Enterprise Institute, also a longtime Washington watcher. And Clay Johnson started the company that provided tech and online strategy to the 2008 Barack Obama presidential campaign. Good to see all of you. Clay, I want to start with you because, again, this isn't the first time that the government's use of contractors has been called into question. We were just talking about Edward Snowden and his disclosures of the NSA surveillance activities. Snowden, of course, a government contractor whose security clearance was granted by another government contractor. Why is there so much reliance on outsiders? Why can't government workers, Clay, why can't government workers do these jobs?
Well, I think government workers can do these jobs. The problem is that the hiring and firing policies inside of the federal government are pretty hard to manage and deal with. It takes a long time to get someone inside of the government. Oftentimes, it takes longer to get them inside of the government than it does to get them to do the actual work. So with something like Healthcare.gov, I'd estimate, you know, a standard company could probably build something like Healthcare.gov with 50 to 100 bodies. That would take a long time for government to hire up all those people. Now, what government should be doing is hiring some really great talent, centralizing them, and having them work across different agencies to help them with their different technologies.
So why do we do that?
How do we do that?
No, why don't we do that?
We should do that. That's actually what my New York Times op-ed yesterday said. The UK did do that. Just a few years ago, they created a government digital services that centralized technology inside of a cabinet office and works across various offices and agencies inside of the UK government. They've saved billions of dollars doing it, and more importantly, are delivering effective services to citizens that work.
Norm, the Sunlight Foundation issued a report on the contractors chosen to build the Healthcare.gov website, and it found that of the 47 contractors chosen, some 17 ACA contract winners reported spending more than $128 million on lobbying in 2011 and 2012. 29 had employees or political action committees or both that contributed some $32 million to federal candidates and parties in the same period. Norm, that smells funny to me. Is it sinister, or is this merely another example of the way modern Washington works?
It's more an example of how the modern Washington works. And on the surface, if you have a company that is big and active in politics, I don't have a particular problem with that. Where I would have a problem is if you're getting sweetheart contracts or sweetheart deals. I don't see any sign of that with the contractors at this point that have been involved with building Healthcare.gov. I think the problems are of a different order, and they're really some of the things that Clay has pointed out numerous times. It's really not having a kind of coordination and not having the talent together inside the government that is up enough on modern tech policies to be able to coordinate these things. You want to watch this stuff, and you want to make sure that you're not dealing with people who are simply clever at doing the requests for contract bids and know how to file them. Yeah. You want people who have expertise, but the rest of it is not the greatest concern.
Jay, are these glitches, are they going to merely be a flash in the pan, or is there a real possibility that these glitches have a lasting effect on the long-term viability of Obamacare?
Well, there are big stakes here. If it's fixed by the end of November, this will all be a footnote. We'll be able to joke about how terrible it was when the system first came up, and everything will be great. In fact, it might even be a little better because there's been so much publicity about this now. If the system is fixed, everyone knows about it, so that's great. On the other hand, if it's not fixed, it'll be terrible for Obamacare, but it will also be terrible for the government, for the anti-government crowd, the people who hate the United States government.
Right.
will use this as an example, as an argument. Anytime the government wants to do great things, they'll point to this. So the stakes really are very, very big here.
From now until the end of time. Clay, your company developed the president's 2008 campaign website, but when asked to work on Healthcare.gov, you said, quote, and I want to make sure I get this right, according to the article, it was a project I wanted to steer clear of. Why?
Well, because 94% of these projects fail. The standings group earlier
specifically?
The standings group earlier this week issued a report that said that federal IT projects of greater than $10 million have a 94% chance of failure. 94% of them fail. So that's a staggering number. I think that working on projects like this and the way that they're being managed and the way that they're being contracted out clearly has to change. The federal government spends $80 billion a year on information technology, and now we're looking at a staggering level of failure. And it's clear that we as a country, the Congress, we all have to figure out how to make a system that works better.
Norm, you wrote in the National Journal this week, in part, it was the remarkable lack of concern with managing the government, seeing the effective implementation of the laws as important as their passage. That is the key here, and the buck stops and starts with the president. How do you think President Obama should have handled this from the beginning, Norm?
Well, I think we needed, now we have Jeff Zients, who's a terrific guy, in charge, and somebody who can coordinate all of this from the top. That didn't happen. You had people in the White House, you had people in HHS, you had outside contractors that were not working together, coordinating together. They didn't put together the front end and the back end. A lot of it is the kinds of problems that Clay is talking about. But, the larger point of my piece was that I think the biggest failure that we've seen in the Obama administration and the Obama White House is there has been much less concern with public administration, running the agencies, making sure that the laws you get passed, remarkable success at passing the laws, actually get implemented well, and this is the prime example of that failure.
Former HHS official Jay Angoff, Norm Ornstein from the American Enterprise Institute, and tech guru Clay Johnson. A big thanks to all of you for that valuable insight.